my name is Taylor Miskinnis. I'm doing my video on medication administration with primary IV tubing. To begin, I would assess the MAR, which I do have printed. I'm just gonna set that there. So I am looking over the MAR for Millie Larson, date of birth 1/1/36. Doctor has ordered 500 mLs of 0.9% sodium chloride, normal saline at 125 mLs an hour. The drop factor is 10 drops per ml. So mathematically, it is going to be 21 drops per minute. It comes to 20.83, but then you round it to the nearest whole number, which would give you 21. So I'm going to look over this MAR again and see if the patient has any allergies. As stated, it says no known allergies. I would also verify this with the patient, making sure that this is correct. What is on her MAR matches what she is aware of. I would then perform hand hygiene. My stuff is right here, along with my sharps container. So I would perform my hand hygiene. I have my appropriate supplies. This is my patient. My IV is already set in place in the patient. It is patent, the wristband, alcohol pad, 2 gloves, my primary administration set, and my 500 mLs of 0.9 sodium chloride. I would check all the expiration dates. So for my solution, I have an expiration date of January 1st, 2023. Administration set expiration date is 6/30/2023. So I would provide privacy. I'm just gonna move my MAR. So I've checked for expiration dates. I do have my hooks hanging. I do have both of them for my secondary as well. My smaller one is going to be for my primary. So I've done all that. I would perform hand hygiene again. I'm gonna identify the client using 2 forms of identification. So that would be her wristband with the MAR. It would be 1. So Millie Larson, 1/1/36 matches. And then I would verify with the patient, Millie Larson 1/1/36, and she does agree. I would verify that she does have no known allergies, which is great. She agrees. So my next step is going to be opening my IV administration set. Garbage. 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 My personal theory is just making sure that none of this gets all tangled up. There's no knots. So when I do go to administer the saline, it becomes easier for myself. As you can see, I'm off to a bad start. Okay. So I would make sure that the roller is clamped all the way closed, which it is. I'm going to remove the cap from the spike. I have my bag upside down. I will remove that cap as well from the bag. I will spike the bag with the IV tubing. I'm gonna squeeze the chamber in order to fill it with saline. I'm gonna hang my tubing, my saline and my tubing, just until I'm ready to place it in the IV site. I am gonna unroll this, unclamp, and make sure that I do not have any air bubbles, letting the fluid run through the line. So I do have a couple that are coming through. I'll get those out. I'm gonna reclose that. We are all set. I do not have any bubbles. Just gonna rehang that until I'm ready to administer the saline into the patient. So I'm going to perform hand hygiene again. Of course, I took too much, so my gloves are gonna be a little difficult to get on. Okay. All right, I'm gonna put my gloves on. Clean gloves are on. I am now going to assess the IV site that is in place now. So I'm going to ask the patient if she's experiencing any pain in the area. I'm going to palpate, making sure that I don't feel any crepitus, any, erythema, swelling, anything to that extent. Everything feels fine. Patient has no complaints. So I'm going to take my alcohol pad. I'm gonna scrub the hub of the IV site, making sure it's clean. I'm gonna take my IV tubing, a little caught up. Okay, I'm gonna remove the cap, maybe, and I'm going to place this on the IV site on the patient. So I would then remove my gloves, trash. I am going to, I'm just gonna put this up here while I'm doing this. So I'm going to run this at 21 drips per minute. So I'm gonna time this, making sure I have an accurate drop. 1, 2, 3, 4, 5, 6. Slowing it down a little bit. 7. 8. 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and 21. So we're good, actually. That was actually good. So I did have to slow that down a little bit in the middle. I was running a little too fast, so I just slowed that down. We seem to be running fine. So 21 drops a minute, which is good. I am going to perform my hand hygiene once again because I am going to reassess the site now that the fluid is running, making sure that the patient isn't having any pain, swelling, anything in that matter. So I'm sorry. So I would don another pair of clean gloves. I'm just getting my gloves. Sorry. So I'm donning another pair of clean gloves. So I would, like I said, reassess. So palpating, asking the patient if she's experiencing any pain. And if she was, I would stop the IV administration and possibly discontinue the IV altogether, placing it in a different location. But the patient has no complaints. We are running smoothly. So we're gonna leave that. We're good to go. I'm gonna just making sure my IV tubing is not gonna fall. I'm gonna discard my gloves once again. Garbage. Perform hand hygiene. And I'm gonna document on the MAR that I placed the 500 mLs of normal saline On the IV site that the patient has, I would mark down where her IV site is located. I would document the drips per minute, what is running currently, and how the patient tolerated it.